It's Certified RN and Shanna here with Karen, and today we're going to go over question number 5. You ready, Karen?
I'm ready, Shannon. Nice to
Okay.
meet you.
Nice to see you too. All right, so question number 5, you can see it below. I'm going to read it right here from my phone. The patient has dilated cardiomyopathy, DCM. Which of the following are expected findings? So you can see your answers there. We have 4 choices. A, B, C, and D. It'd be best to pause the video now so you could actually make your own choice and then resume the video as Karen gives us the answer and we discuss why that answer is true. Okay, so go ahead and pause and then come right on back. Okay. All right, welcome back. All right, question number 5. All right, Karen, give us the answer to number 5.
Answer is number B.
It's B. Okay.
Yes. And so let's just look at that one for a minute in terms of dilated cardiomyopathy. So in dilated cardiomyopathy, I like to think of the basketball.
All right.
So you have this big myocardium that's really kind of outgrown its blood supply. It's boggy and it's full of blood. And one of the things that happens is that the mitral valve leaflets, they kind of pull out as the myocardium gets larger, and they pull away and it causes mitral regurg. So mitral regurg is really common in dilated cardiomyopathy. So where do we hear the mitral valve? Over by the apex. So that, just remember, where you hear your valves is always important for you in being able to answer these questions. So mitral regurg, and it's going to be a systolic murmur, because remember, during systole, as the ventricle contracts, blood is going to back up. And so you're going to hear the blood going through that mitral valve, and that'll be a systolic murmur. And then some other things that happen in dilated cardiomyopathy, it's a lot like heart failure. You get left ventricular hypertrophy. A decreased ejection fraction is also commonly seen. So that is your best answer. That is really your only answer here. None of the others are accurate. If you look at A, it's a diastolic murmur. So that, and it's on the right sternal border. So let's just think about right sternal border. That's always going to be aortic kinds of problems. So always think aortic on that right side. If you look at number C, once again, right sternal border, and you wouldn't expect that also. And then if you look at D, so what is wrong with D? Oh, this is an important point. It says that the patient could have an elevated BNP. Well, patients with cardiomyopathy, as long as they're well managed, they might have a normal BNP. There's no heart damage going on, no overstretching of the ventricle going on if they're well managed. So that's not going to always necessarily be true.
Oh, awesome. Thank you so much, Karen. I guess it is really important to have an understanding of just like the basic anatomy of the heart, because I like that you keep referring to, if you're going to talk about murmurs, like actually where that valve is on which side of the heart and which side of the chest as a, a location point. So that definitely helps me be able to remember like where those valves are. So thanks, Karen. Much appreciated. All right, everyone, stay tuned for our next question. Bye.